All right, so YouTubers, this is so weird. So Ash asked me to talk about transitioning and why therapy is important in the transitioning process. And so I'm going to kind of go over some of the nuts and bolts of that. I'm a mental health professional myself, and I work with, my passion is working with transgender individuals, and I am transgender myself. So, to get started, there's this standards of care. It's called the Harry Benjamin Standards of Care. And they're basically, it's like a outline, or like a 20-page outline of the most ideal way of going about transitioning. A lot of people don't adhere to this. A lot of practitioners don't necessarily adhere to this. A lot of people who undergo transitioning may not even seek the help of therapists, medical doctors, what have you. They may get their hormones and things off of the black market, which is not good. So that's why we have these standards in place. So when somebody wants to transition, it kind of happens in a variety of ways for different people. Sometimes people go into therapy initially with maybe a minimal awareness or a big awareness that they are transgender. A lot of the students that I've met with who decided to transition came in a state of distress, and a lot of times, most times, it was related to the fact that they were trans but felt pressure from society to be a certain way and fit into a certain binary. They thought that there was something inherently wrong with themselves. Some students that I've seen, some clients that I've seen come in, they know they're trans, they're ready to go and begin the process. But obviously that involves a bit of assessment on my part and exploration. So I'm going to talk to you a little bit about what that involves. So the really treatment, like when it comes to transitioning, it's really a treatment team is the most ideal. So that consists of a therapist, medical doctors, maybe even voice coaches, coaches like that focus on more interpersonal aspects. I mean, there's a whole range of people that can be involved on the team. But the mental health professional is really kind of, I would say, the first kind of step in the process. And the reason for that is because you have to, the mental health professional assesses whether the person is, first of all, psychologically stable enough to make an informed decision to take hormones or to undergo top or bottom surgery. Sometimes people may come in and say, hey, I'm ready to transition, I'm good to go, but they may be seriously depressed. They may be super anxious. And so you really want to kind of deal with those presenting issues first before getting them started on hormones. Another part of the assessment process is, and these are really extreme examples, but they're really the only ones I could come up with. So you may have a person come in and you want to screen out for other serious mental health issues such as multiple personality disorder or a variety of other things. So you want to make sure that the presenting issue is what it is, rather than somebody being delusional and therefore thinking that they are a man, or it being a multiple personality sort of issue. So you really want to tease those factors apart. So that's part of the assessment process, and then once you get through that, you start to talk to the client about the risks and the benefits of undergoing hormone therapy as well as surgeries. So, because this is a heavy-duty thing, it's not to be taken lightly. There are health risks and benefits. There are interpersonal risks and benefits, financial issues that I think a lot of people come in to the process totally unprepared to deal with. And so a lot of the therapy is really designed therapy, so to speak, is designed to educate the student or the client, to encourage them to seek out resources, to talk to them about, the health risks. So, for example, when you take testosterone, it could damage your liver. It could, it raises your cholesterol. It may make you more prone to having heart issues, a lot of the same health issues that men have. So it's important for the client to be informed about that. Some people are seriously deterred from that, understandably so. You also want to talk about the risks or the limitations of reproduction. For example, taking testosterone has an impact on your ovaries. So that's something that you really want to delve into if the client wants to have their own genetic children. Obviously, you have to prepare the client for the desired benefits of taking a hormone, for example. So, hair growth or the recession of hair, acne, more lean kind of muscle mass, redistribution of your fat. So there's a whole variety of changes that happen, and I know that when I started the process myself, there were a couple that really shocked me. So it's really important to go into it knowing what you're getting into. The interpersonal costs and benefits, a family. What impact is transitioning going to have on your relationships with family members? Some people may be okay with it. Some people may have a lot of discomfort. Also, a lot of times with parents, they go through a mourning, kind of like a grieving process. And so it's important to be aware of that and to kind of maybe be patient, with your family. So it's important to know what the risks are. I've met with students who have had parents that have been completely accepting, just really wanting them to be happy and authentic and congruent. I've had people whose parents have done horrific things to them after they've come out as trans. So it's important to really explore and kind of anticipate what the coming out process will be for your relationships. What's it going to be like at work? How are people going to respond? And just being aware that discrimination can lurk out there. Another thing that's important to be prepared for, especially when it comes to surgery, for example, that's, with hormones, those effects are partially reversible. That's what the Harry Benjamin standards of care talk about. So when you stop taking hormones, some of the, some things, go away, some things continue, as they are. With surgery, those aren't so reversible. So it's, you can, but it's very expensive. The health risks are even more serious, and so you really want to have it really nailed down before you go under the knife. So a lot of doctors some doctors, the standards of care really say that you need 2 letters or 2 doctors or mental health practitioners to vouch for you and your readiness. Some doctors just need a simple phone call. But it's really important for the patient to know, okay, you're going under the knife. Things are being removed or added to your body. And these, there's some aftercare that needs to, that's really important, and there's preparation for the surgery that's really important. So therapy can be, whereas mental health practitioners are not medical doctors, it's upon us to help educate the patient as to what those, what the surgery may involve and what the options are out there. I think just the real main issue why therapy is important is so that the patient can make an informed decision and that they're in a good mental and emotional space to make that decision. It's kind of like, this might be a bad parallel, but it's kind of like when somebody is declared competent or not competent to stand trial, and in a court case, it's kind of the same premise. It's that the patient understands what they're signing up for, and that there are no mental health issues that are conflicting with that. There are no social issues that are conflicting with that, and that they can say they're in a place to say, yes, I know what I'm doing, and I'm prepared to accept the risks and the benefits of it.